Hello, folks, and a happy new year from everyone returning from holidays. I wanted to give a big thank you to all staff who worked throughout the holidays to collect our garbage, plow our roads and our sidewalks, and kept our trails accessible, our drinking water safe, and maintained our city's infrastructure. I obviously can't name all of you, but my point here is to thank all of you, so thank you. I also wanted to connect with you about the recent provincial announcements over the holidays, and we've seen some changes to the isolation periods, who gets tested and when, as well as closures to some of our city programs and facilities. Additionally, some of our part-time staff are starting the new year on a temporary leave, and this is due to closures inside culture and recreation and our crossing guards. And culture and recreation staff give so much to this community by way of health, wellness, and joy, and our crossing guards play an integral part in neighborhood safety, becoming a familiar and friendly face to kids across Guelph, and we look forward to welcoming them back as soon as the provincial orders allow it. I also want to reassure you that no additional layoffs are planned at this time. Before the new year, we had started planning for a return to in-person work. These plans are now paused until further notice. Anyone who can work from home must do so under provincial public health guidelines. Only essential workers who must be physically present at our facilities to do their jobs should be on site. We continue to monitor COVID-19 cases amongst our staff for health and safety and operational issues, and it's important that we have healthy staff to deliver core city services to our community. And I'm happy to share that our current case counts among staff are extremely low. You can help us track cases by using sick time and sharing whether or not the causes is COVID-19 related. On December 30th, the province announced that self-isolation requirements have changed. If you're vaccinated but become symptomatic or have a household high-risk contact who has tested positive for COVID-19, you must self-isolate for a minimum of 5 days. If you're vaccinated and the high-risk contact is not a member of your household, you may come to work. You must self-monitor for symptoms and self-isolate immediately if symptoms develop. If you're unvaccinated and become symptomatic or a high-risk contact of a positive case of COVID-19, you must self-isolate for a minimum of 10 days. This is regardless of whether they are a household contact or not. There are no changes to how many vaccinations you need to be considered fully vaccinated. We still encourage all staff to get a booster vaccine to help provide protection against Omicron variant. You can book a dose locally on your public health website. Testing of unvaccinated full-time and part-time staff continues to be a priority as part of our COVID-19 staff vaccination policy. And we're hearing lots of questions about masks in the community and here at work. There is no change to our masking policy. Please continue to use a 3-ply or surgical mask with a tight fit around the mouth and of course the nose when any distance can't be kept. So again, N95 masks are in short supply and most are needed in our healthcare settings where staff are at a higher risk of exposure. And we will continue to monitor best mask practices in addition to advice from the Wellington Dufferin Guelph Public Health Team. Each time I do one of these updates, I find myself repeating mental health supports available to us as staff. But it's an important piece here that when we show up to work each day, we recognize that each of us are facing different levels of change and challenge. One person's hard is another person's easy. So reach for compassion as you interact with each other. Let's be flexible in our expectations. Some of us are caring for sick loved ones, children doing school virtually, and amongst all kinds of other unique circumstances that we may not be aware of. So just keep that in mind as we interact with one another. These are hard, difficult times as we enter 2022. Hopefully it's for short duration, but we're having difficulties and we might not see that on the surface. So just be aware of that. I hope that you know this already, but I just will repeat it here. We keep a list of resources on InfoNet under COVID-19 tab for mental health supports. We obviously pay into these supports, so please use them. They're there if it's needed. And as always, thank you for all your work this past year, and of course going into 2022. really is something that I say lots because I mean it and it's truthful. I've never been more proud to say I get to work with each and every one of you. Take care.